Hey lovely people, welcome to my channel. And so guys, in today's video we are going to be talking about top reasons why people fail A to E assessment of a dying patient. I've gotten a lot of emails. Nurse Violet, please can you talk about dying patients? I failed because of this, I failed because of this. So in today's video, let's talk about A to E assessment of dying patient. Before we dive into this video, I am humbled. Like guys, too many messages. I got over 7 messages yesterday of people who sent me their message and said they passed their OSCE exam. So if you pass your OSCE exam, just keep a message in the YouTube channel. I appreciate you for sending me a mail, but I couldn't reply any of you. But if I've ever replied you when you tell me you pass your OSCE exam, I would always say keep it on the YouTube channel, because when you send me a mail, I only see it. But when you say it in the YouTube channel, it's like an encouragement to others to say they can also pass their OSCE exam. And like I keep saying, the OSCE is so simple. So practice with your peers, practice with your friends, and you'll be successful. So guys, let's talk about dying patients. So please share this video with everybody you know preparing for OSCE exam. Don't forget to give this video a like and don't forget to subscribe. So come with me and let's dissect A to E assessment of a dying patient. Come on.
Ryan Little.
Guys, the first thing I would say to you is when you are doing your A to E assessment of a dying patient, please pay attention to every detail I will share in this video. So when your assessor tells you welcome to the new test of competency, blah blah blah, look to the camera, blah blah blah, confirm you don't know me, blah blah blah, and she tells you you're starting with assessments. Okay, so mind you, you can either start your OSCE exam with assessments or you can start with skill, so whichever. But because I am teaching you today A to E assessment of dying patients, so let's assume your assessor tells you, Violet, you're starting your OSCE exam today with assessment. The time allocated to this station is 19 to 20 minutes and she will run you through. Okay, do you have any question? And you say no, and she presses on the timer like this and says your time starts now. So if she tells you assume all checks have been done, please do not check for scene safety and do not provide privacy. Just go straight to your hand hygiene, okay? But if she does not say anything to you and she does not say assume more checks have been done, please verbalize. I check for scene safety, I provide privacy for my patients, and then I do my hand hygiene according to World Health Organization. Palm to palm, right palm over left bosom, vice versa. Fingers interlaced, fingers interlocked, fingers interlocked. Rotation of the thumb, tips to the finger, and the wrist, and my hands are clean. So you can actually use gel, which is the sanitizer on your hand, or you can actually wash your hand, whichever is up to you, and both are correct. So now after doing your hand hygiene, I would encourage you to read your scenario first. Take notes, pay attention to everything I'm saying in this video. So I would encourage you to read your scenario first. I will be reading my scenario. I'm not going to put it on the screen, sorry guys, but I'll read it. So just listen attentively so that you can get it. So I'll be reading the scenario on the screen. So before you proceed to your patient, read your scenario first so that you can have an idea of what you are doing. Is it PHQ9? Is it MOST? Is it Alzheimer's disease? Is it asthma? Is it cardiac? But today we're doing that in patients. So read your scenario and they'll tell you something like Ailey Brooke was admitted to the hospital 2 weeks ago with shortness of breath. Patient is a known breast cancer patient, and patient has past medical history of heart failure. Patient has past medical history of chronic kidney disease. Patient prognosis is becoming really poor, and patient is now actively dying with breast cancer with less than 6 or less than 3 months to live. Patient has been treated with oxygen and medication, but at the moment nothing has been working, so the doctors are considering patient is now on the pathway of dying, has few days or few weeks or few months to live. So please carry out an holistic assessment of this patient. Now, what you need to know is either they told you the patient has heart failure, dying with heart failure, or the patient is dying with chronic renal disease, chronic kidney disease, end stage cancer, but the patient prognosis is poor and the patient has few months to live. So carry out an holistic A to E assessment on this patient. So now, because you've read your scenario first, you now know exactly that you are dealing with a dying patient. Now proceed to the patient. Now this is what I will do. Hello, my name is Violet. I'm one of the nurses looking after you. Please, can you tell me your full name and date of birth? And she tells you, my name is Ellie Brooke and my date of birth is 15 February 1940. Oh, thank you very much. Can I please double check that with your wristband? Take notes. Make sure you are looking at your paperwork and you are looking at the patient wristband at the same time. Otherwise, you might fail because you are just saying, I have here. No, make sure you are looking at your paperwork and the patient's wristband. So I have here Haley Brooke, date of birth 15 February 1940, hospital number 100010. Does that make sense? Now, the next thing you say is, do you have any allergy? And the patient tells you, no, I have no allergy. Can I look at your wristband? So make sure you look at the patient's wristband, whether they have an allergy or not. Look at it. Oh, that's why you have a white wristband, Mrs. Ely, because you said you don't have any allergy. Okay. So the reason I'm here this morning is to carry out an A to E assessment on you. Is this a convenient time, please? She tells you, yes, it's a convenient time. Now, do not tell the patient, do you want to use the washroom? Are you in any pain? No. The thing is, it's a time waster. Do you understand? Just go straight to the point. The reason I'm here is to carry out an A to E assessment. So is this a convenient time? And the patient says yes. All right. I'll quickly leave you with a call there while I prepare all my equipment. If you need me, use your call there. Okay. The patient will say okay. Now, hand hygiene. So after doing your hand hygiene, put on your apron, put on your gloves. Assessor, can you please confirm every of my equipment is clean and ready for use? Assessor tells you, that's correct. Please proceed to the patient. So you go back to the patient. Mrs. Haley, I'm back. Are you happy for us to continue? The patient tells you yes. Now, somebody in your mind or in his mind is saying to me, Nurse Violet, is it compulsory to use apron and glove for assessment? It is not compulsory to use apron and glove for assessment. Bath. Sometimes it just might be compulsory. Remember, you're touching the patient. So if you don't use apron and glove for assessment, nobody will fail you though. If you feel like using, go ahead and use. This entirely up to you for A to E assessment. Okay. All right. So Mrs. Haley, are you happy for us to continue? The patient tells you yes. All right, Mrs. Haley, I'll be carrying out an A to E assessment on you now. But before I do that, I will do a quick observation on you. Can I see your left hand, please, or your right hand? So whichever hand you want to use. All right. So the patient gives you their hand like this, and you say, I can see your hand. There is no redness. There is no swelling. There is no infection. I'm happy to use your right hand. Okay. All right. So I will tie the cuff 2 to 3 centimeter away from the cubital fossa. Is that okay? The patient will say yes. Now, have you ever had surgery on this hand? And the patient says no. So you tie your cuff 2 to 3 centimeter, or you can tie your cuff covering 80% of the upper arm. So listen attentively. So when you tie the cuff, please do me a favor, do not on the machine yet. So tie the cuff on the patient's hand and say to the patient, can I see your nail beds? The patient will show you their nail beds like this. All right, I can see your nail beds. There are no redness. There are no swelling. There are no infection. I'll do a capillary refill. Assessor is less than 2 seconds. I put my probe. Because you will be having a live patient for your A to E assessment. Okay, so put your probe. So now you've tied the cuff on the patient's hand. You've put your probe on the other hand. Okay, so now on the machine. Now the machine is doing vroom, vroom, vroom. So while the machine is doing that, get your news chart. Hope you're listening. Get your news chart. On your news chart, the patient's name would have been written for you. The patient date of birth would have been written, and the date of admission would have been written. Okay, so but you have to write the date and the time. So write the dates. Make sure you write the date and make sure you write the time. Now after writing, now the machine has finished reading chart your blood pressure. And when you chart your blood pressure, when you've gotten your blood pressure, please pay attention, okay? Make sure you chart the blood pressure. Chart it on the news chart. A lot of people are failing because they will go and chart it first on a piece of paper. Then they will now later transfer it on the news chart. No. Chart it exactly on the news chart, okay? So now let's assume the patient blood pressure is 120/80. Chart on the news chart 120/80. Look a second time. Guys, please look a second time. Like this is what I say to my online students, okay? Look a second time that you're chatting it exactly at 120 and you're chatting it exactly at 80, and look the whole time. Do not rush. Take your time on your news chat. Now the saturation happens to be 95. Go to saturation, use only scale 1. We don't use scale 2. Chart the saturation 95. Look a second time. That's what I say to my online students. So pay attention. Look a second time that you're chatting it exactly at 95. And look at all time that you're chatting it exactly at 95. Alright? Now that's done. The next thing is to count your pulse. Now guys, make sure you count your pulse for complete 2 minutes. Now guys, I'm just trying to get my stopwatch. If you count your pulse for less than 2 minutes, it's a fail in OSCE exam. You're failing, and the assessor is going to tell you candidate counted pulse for 1 minute 56 seconds. So make sure you count your pulse for exactly 2 minutes. So on your exam day, you get a stopwatch similar to this on the patient's table. If you like to take your stopwatch, you can, but this stopwatch will be on the patient table. So pick it up. Mrs. Haley, I'm going to count your pulse for complete 2 minutes. Come in, darling. So you put your 2 fingers on the patient's radial artery, or 3 fingers, all right? Just the way I'm doing now. All right. Immediately you start feeling the pulse, look at your stopwatch. Assessor, my time starts now. So while you are counting, your assessor is also looking at their timer, just to be sure you counted the pulse for 2 minutes. And you know, you don't tell the patient you are counting their respiration. Do you understand? So that the patient, you don't just, or you don't make them breathe faster. So I'm holding my stopwatch and I'll count my pulse for 1 minute. After counting my pulse for 1 minute, my patient does not know. I'll start looking at the rising and falling of the chest for another 1 minute, and I'll make sure it's exactly 2 minutes. So once it's 2 minutes, I'll stop. I'll go and chat. I'll pick it. I'll look for my pulse. Can you close the door for me, please? I'll look at my news chart and I'll put my pulse. Maybe I get a pulse of 90 beats per minute. All right, pulse 90 beats per minute. I'll look a second time that I am putting a dot exactly at 90 beats per minute, and I'll look the whole time that my pulse is exactly at 90 beats per minute. Does that make sense? Now, my patient's respiration, for instance, happens to be 20. I'll put a dot on 20, look a second time that I'm charting the respiration exactly at 20, look the third time that I'm charting my respiration exactly at 20. Now I'm done, guys. The next thing is, Mrs. Haley, can I check your skin, please? The patient will say, yes, nurse. I'll look at your forehead. I can see your skin. You don't have to touch it. There is no redness, there is no swelling, there is no infection. I put my, so try to take the temperature on the forehead. These days they say you're taking it on the temperature. They won't fail you though, but just try to take the temperature at the forehead. Does that make sense? So you take the temperature. Now if you are, take the temperature, and let's assume the temperature happens to be 37. You record temperature 37, and so if your assessor does not tell you patient is on oxygen, please tick patient is on air. Do you understand? All patients in OSCE exam are alert, so tick alert. Go through your news chart 3 times, all right? Then turn to the back of your news chart. Mrs. Haley, I'm done with your observations. You're having a news of 1. So for a news of 1, I'm going to monitor you every 4 to 6 hourly, and I'm going to be escalating your care. Is that okay? The patient will say yes. Tick! Yes, so I'll be so proud of you, okay? Now, Mrs. Haley, for your airway, both of us have been talking, and can confirm that your airway is clear. Or do you think that you're having any obstruction at all to your airway? Nurse, I used to have some obstruction to my airway, but I've been taking my just in case medications, and now my airway is okay. Oh, bless you. I'm happy to hear that. Can I ask you to cough for me? All right, I can confirm that at the moment your airway is patent and clear, and like you said, you've been having your just in case medication, and so for now you feel that you are okay. Okay, but if there's anything, like I said, we'll just escalate to us. Okay, now, it's possible the patient's airway might not be clear. So if you feel their airway is not clear, also say it, okay? Now, I move over to breathing. For your breathing is respiration and saturation. So for your breathing, I did your respiration for complete 1 minute. And there is no stridor, there is no use of accessory muscles. There's no sign of respiratory distress. There is no coughing. There is no wheezing. I'm very happy with your respiration when I did it for complete 1 minute. There is no respiratory noises, and I'm happy with that. Okay. When I checked your saturation, yes, your saturation happens to be 95, so you are scoring 1 for that, but it's not too bad. Okay, it's not too bad at all. Okay, I move over to your circulation. For your circulation is blood pressure, pulse, and capillary refill. So when I did your blood pressure is 120 over 80. That's within the normal range. If it's high, say it. If it's low, say it. That's within the normal range. I'm not worried about your blood pressure. Okay, I also did your pulse for 1 minute. The strength of your pulse, the rhythm of your pulse, and the rhyme of your pulse happens to be okay. Your pulse is 90 beats per minute. Okay, and when I did check your capillary refill, you properly perfused and there's no cyanosis. Okay, so I'm happy with that. Okay, I move over to disability. For disability, Mrs. Ely, can I ask you, do you know where you are at the moment? Why not Violet? I know I'm in the hospital. Oh, bless you. Bless you. I'm so happy you know where you are. And can I just say to you, are you having any pains at all in any part of your body? Nurse Violet. Oh, bless you. Bless you. Bless you. Nurse Violet, I usually have pain. When I come out and try to walk, I will have pains. Okay, so what about now you're sitting down? Are you having any pain? No, I think I'm okay. Anytime you have pain, please don't hesitate to tell us, okay? We don't want you to have any pain because we can actually manage the pain when it comes because we have a lot of analgesic for you. Is that okay? All right. Can I just ask you, how about your eating? Are you eating and drinking okay? How is your urine output? No, so my urine has been dark. Are you eating and drinking okay then? I really don't have an appetite. Okay. What about flu? Do you like drinks? Which of the drinks do you like? Because you have to eat like gently, small amounts of food. Okay. Which of the drinks do you like? Oh, you like Coke? That's fine. We can see how we can get that for you because it's important for you to take little at regular interval, especially flu. They are important. Okay. What about your blood sugar? Has any of the nurses checked your blood sugar today? One of the nurses did. Oh, I don't know the reading. Assessor, can you please tell me my patient blood sugar? And probably assessor says 5.6. That's within normal range because the normal blood sugar is 4.0 to 8.0. Okay, so well done, my darling. I move over to exposure. For exposure, I did your temperature. Your temperature is 37. Do you have any rash? Any wound, any swelling, any bruises in any part of your body? And she says, no, nurse, I'm all right. That's fine. I'm very happy to know that. Okay. So, Mrs. Haley, can I just ask you some activities of daily living? And she says, that's fine. Go ahead. Do you have any preferences at all? She'll say, what do you mean by preference? Is there anything you want us to do for you? No, so I think I'm okay. All right. What about your spiritual need? Do you want us to invite any of your spiritual leaders? Oh no, thank you for letting me know that. I have a confession to make. Can you please invite a Catholic priest so that I can make my confession? Oh, that's fine. That's really fine. I will, make a referral and we can get your Catholic priest. Oh, that would be lovely. All right. Is there any other thing you want us to do for you? So, how about your mobility? Nurse Violet, anytime I mobilize, that's when I experience my shortness of breath. But I don't want my mobility to be taken from me. I still like to mobilize. Oh, bless you, don't worry. So, what we're gonna do for you, anytime you wanna mobilize, just use your call bell, okay? And I'll be at your back while you mobilize. I wouldn't stop you, but I'll just, be at your back just so you can still do those things you have been doing. Oh, bless you, Nurse Violet. That will be wonderful. That's absolutely fine. And is there any other thing you're worried about? Oh no, Violet, I'm worried about my dog. Why is that so? I don't know if anybody has been looking after my dog. Oh, and I would love to see my dog. Okay, that's fine. I'm going to contact your next of kin if you are happy to, and we can see if we can invite your dog over. Would that be something you're excited about? That would be great. All right, so guys, that's all generally about A2E assessment, and you must not finish, but wherever you stop, try to make sure you do the right thing. And if you have any question, pop it up in the comment section. Okay, I'll see you in my next video. All right, so I don't want this video to be too long, but then if you are a channel member to this channel, you get a lot of benefits. How there are a lot of videos that are not out or available for everybody, but it's for channel members only. And for you to be a channel member, you just have to be paying £2.99 every month, and you can also subscribe if you like. So guys, I'll see you in my next video. I'm going to church, like I'm going to pray for every one of you writing your OSCE exam this week. You have passed as the Lord living. You know, I'm a Christian. You have passed. All right, love you, love you, love you. Bye.